Hello and welcome everyone. Today we'll be discussing about the new treatments for ICH. ICH is one of the most devastating variations of stroke. In the last 1 year, there have been a lot of new trials which have been coming positive with new treatment modalities. We will discuss them and to see what is the new era of ICH management. Bleeding within the brain tissue due to the rupture of the cerebral vessels is what is called ICH. It accounts for 10 to 15% of all the strokes globally, higher incidence in lower and middle income countries. In the current trends, there is an increased incidence due to the aging of the population. Greater use of anticoagulants is also contributing to the higher risk. The poor prognosis is something which is very closely associated with ICH. The higher rates of mortality and disability is seen with ICH. There are very limited effective treatments available. Past RCTs have yielded neutral or inconclusive results. So there is a clinician nihilism. There is a negative perception when a patient like this comes into the ICU. So there is a therapeutic inertia and frustration builds up due to the lack of progress in these patients. So there has been a change in the landscape for the ICH management. So there have been some recent positive trials, that is in 2023 marked several pivotal RCTs which came positive, and there is a shift in the perception, that is from nihilism to optimism. So why the change is occurring? It is because of improved understanding of the pathophysiology and development of targeted interventions. Better trial design and patient selection is also helping us in getting positive results. So the treatment targets in ICH, the immediate goals is to stop the bleeding and to prevent the hematoma expansion, control the blood pressure, reverse the anticoagulation if applicable. Secondary goals being to remove the hematoma when appropriate, prevent secondary brain injury. Finally, we must optimize the physiological parameters so that we don't do further damage to the brain. So coming to the first trial which came positive, that is the Interact 3 trial. It was a care bundle approach. The population was 7,036 patients with acute ICH across 121 hospitals in 10 countries. The intervention here is the implementation of a care bundle protocol, that is intensive blood pressure lowering, glucose control, temperature management, and dysphagia screening. So the comparison was usual care with a standardized care bundle, and the outcome showed that the functional outcome was measured here in terms of modified Rankins, and the results showed it reduced poor outcomes with a significant p-value. The significance here is that it demonstrates that the systemic care improves outcomes in patients with ICH. It supports the adoption of care bundles in the clinical practice. Next is the Enrich trial, that is the minimally invasive surgery. 300 patients with ICH within 24 hours of onset. Intervention here is the early minimal invasive surgery using transsulcal parafalcine approach with brain path system. The comparison here is the standard medical care, and in this the outcome they were looking for is the functional outcome with the modified Rankin. The surgical group had better functional outcomes compared to the standard care. The significance here is that it provides evidence supporting surgical intervention in a select group of patients. It highlights the importance of minimally invasive techniques. The next is the Annexa A1 trial, that is Adnexanet alpha for factor Xa inhibitor associated ICH. 530 patients with acute intracranial hemorrhage on factor Xa inhibitors within 15 hours of the last dose. The intervention is the administration of the reversal agent to reverse the anticoagulation. The comparison is usual care, predominantly using the PCC, that is prothrombin complex concentrate, 86% of the cases. Outcome here is that the hemostatic efficacy, reduction in the hematoma expansion. The result shows that Adnexanet alpha was superior to the usual care in achieving hemostasis. It provides an effective reversal agent for the DOAC associated ICH, and it may improve outcomes in high risk cases. The next is the Interact 4 trial, is the early invasive blood pressure lowering. Patients with acute ICH within 4.5 hours of symptom onset, rapid when intensive blood pressure lowering initiated pre-hospital or immediately upon hospital arrival, and the comparison was standard guideline based blood pressure management. In this, the outcome shows functional outcome was good at 6 months, and the early invasive BP lowering significantly improved outcomes and reduced hematoma growth. The significance is that it confirms the importance of rapid BP control in improving ICH outcomes, supports the reorganizing system of care for urgent BP management. The next is the switch trial, that is decompressive hemicraniectomy, patients with large deep ICH causing mass effect and midline shift. And the decompressive hemicraniectomy without hematoma evacuation was the intervention. The outcome was the medical treatment alone. In this, they were looking for again the functional outcome, and surgery was a viable treatment with acceptable outcomes. The significance is that it offers a surgical option for patients not suitable for hematoma evacuation, because in those patients also a decompressive hemicraniectomy did help in preventing problems. Ongoing research in hematoma evacuation is going on, so there are a lot of trials also going on. These are the name of the trials which are ongoing on hematoma evacuation. The objective is to optimize the surgical technique that we can use in various group of patients. It determines the best timing also for the intervention, identify patients who are going to benefit most. The significance here lies in potential to improve the surgical outcomes in these cases, and this can further reduce the morbidity and mortality. So to summarize, the key findings are there have been a lot of positive trials, that is ENRICH showed that minimally invasive improves outcome, INTERACT 3 and INTERACT 4 provided care bundles and early BP lowering as beneficial. The adnexanet alpha, it was effective in DOAC associated ICH. So in the future prospects, the ongoing trials will refine the treatment. Potential for safer anticoagulation with factor 10 inhibitors. And the take home message here is that ICH is now a treatable condition, and early evidence based interventions, as we have seen over here, can improve outcomes. Thank you.